welcome to HD News. My name is Aaliyah, and our topic for today is going to be euthanasia on dying cancer patients. If you did not already know, euthanasia is the painless killing of a patient suffering from an incurable and painful disease. I am going to be discussing the opinions from cancer patients on euthanasia based on ethics, philosophers, and the general public. Even though people have positive and negative thoughts about this, authors Merritt Carlson, Anna Milberg, and Peter Strang from the Palliative Medicine Study mention that the majority of people were unsure on how they felt about euthanasia. According to results from the survey conducted by the Palliative Medicine Study, some respondents were pro-euthanasia, 29%, and others were against the act of euthanasia, 20%. However, the majority of the respondents were indecisive on how they felt towards it, 51%. Now we will be looking further into why 29% of the survey respondents were pro-euthanasia. This group of individuals stated that euthanasia benefits factors such as anatomy, the escape from depressive-like symptoms, and the termination of pain. Additionally, having a terminally ill family member could be very costly, leaving the patient feeling like a burden. 20% of survey respondents had negative thoughts towards euthanasia. These individuals feel opposed to euthanasia due to several reasons. One of the major factors is patients' mistrust towards doctors. Many terminally ill patients believe healthcare professionals could authorize euthanasia without consent if induced in a coma. Also, patients also believe that many doctors are greedy in the healthcare system and lazy when it comes to palliative care. In addition, cancer patients also believe that approving euthanasia is immorally wrong. These individuals view euthanasia as assisted suicide and as an act of killing the patient instead of killing the pain. Furthermore, we will be discussing why 51% of the survey respondents were indecisive on the use of euthanasia. These patients see the validity of both arguments. Many terminally ill patients mention how having a chronic disease takes a huge toll in their life, due to treatments and severe pain they have to go through. Euthanasia could be the best option to escape the agony that they have been in. Patients also perceive euthanasia as a way to promote suicide. This is why patients have indecisive thoughts on euthanasia. In summary, voluntary euthanasia is when the patient is asked to be euthanized and it is performed by a doctor. Examples of that are refusing to eat, asking for help while dying, and refusing medical treatment. Passive euthanasia is when the patient refuses medical treatment in order to speed up their death. For instance, pulling the plug. Physician-assisted euthanasia is when the patient requests for a lethal dose of something to be injected into themselves. Physician law was voted on in 2008, therefore allowed the practice in the state of Washington. The peer-reviewed writing includes many well-informed beliefs of the topic of euthanasia and physician-assisted suicide. Many people have different beliefs in euthanasia, especially based on their religion. With that being said, the church also educates those that it is accountable to stop medical treatment as well as nutrition and hydration, when the treatment brings more burden to the patient than it interests them. According to a systematic review of religious beliefs about major end-of-life issues in the 5 major world religions, stated that a nationwide survey among nurses in Belgium found that Catholic nurses have lower rates of acceptance of euthanasia compared to non-religious nurses. Only 15% of Italian primary care physicians have been shown to favor euthanasia, whereas 33% agree with withdrawing or withholding treatment in appropriate situations. In addition, Catholic physicians have significantly higher rates of disagreement with non-Catholic physicians regarding legalization of active participation in euthanasia. Some might say life is valuable whether it's worth living or not. Some believers base the option on whether the quality of life exists throughout care of life's good, such as happiness and freedom. Now to Annabelle with the interviews.
What is your stance on the euthanization of terminally ill patients?
That's a two-part answer because first off, I don't believe in suicide. That goes against my religious beliefs. I feel like you're here for a purpose, and until that time comes that you pass away, then you have a purpose still. However, if I had a loved one, I would have a hard time watching them suffer, and I personally wouldn't like to suffer myself. So that is a hard answer. I'm not really sure, unless I was put into that position, what my answer would be on that.
Hi, I'm Jasmine. I have a neutral opinion on euthanasia of terminally ill patients. From a nursing viewpoint, we're here to help provide comfort. We try to improve the health of the patient, but we don't try to end a patient's life. But who am I to tell someone that they have to continue living in pain and have to continue deteriorating when a patient may be able to have a more dignified death if they were to choose when they can pass away and where they can pass away with family. So I'm not really for or against, but I believe that maybe the patient should be able to decide for themselves. And that's it.
Hi, my name is Scooter, and my viewpoint on the euthanization of terminally ill patients is that if they really come to decide that they would like to be euthanized, I think there needs to be a time period for them to reflect on that. I also think they need to seek counseling, see some medical professionals, make sure that, if there are good chances that eventually they could get better. But if that's not the case, then if they would really like to be euthanized, then I believe that they should be allowed to. I think that the doctors still need to put effort into making sure that they're doing the best they can to keep them alive, keep them well. But I just don't think it should affect the doctor's quality of work. If they know that this person is so sick that their chances are very slim and it would be easier to just let them go. I don't think that should be the outcome of this. I think that the people that are terminally ill, if they really choose to and their quality of life is not very good and they think it's just the best for them and their family to just end it there, then they should be allowed to. Of course, there would have to be more processes. I think there should be multiple steps before doing that, just in case. Just in the moment. I don't think anybody should just decide they don't want to be alive anymore, and it should just happen right then.
I'm here with our special guest, Quincy Wilkins. Quincy, what is your opinion on euthanizing terminally ill patients?
I feel as if that's their wishes, that you should go through with it, no matter how your personal feelings are, because it's the patient.